Hi everyone, my name's Sita. I'm a clinical scientist in audiology. And today we have a video here of an ear that's completely blocked with wax. And it's quite a narrow ear canal, and the wax is fairly soft. What you're seeing here is a lot of the wax is going into the tube. The softer wax will go inside the tube, whereas the harder wax will be pulled out as a solid piece. The lighter pieces of wax that you can see here are more of the dry skin and the dead skin that's left in the ear. As the ear canal tries to remove the wax itself, the dead skin migrates forward, and it also builds up in the ear canal, mixing with the wax. You can see as it lifts up from the ear canal wall and a solid piece is removed. And what's left is now quite hard, and the whole plug is moving forward with every rotation of the suction. There we have it. You can see the eardrum faintly in the background and some more solid wax against the ear canal wall there. Now, whilst that doesn't affect the symptoms in any way, it's just nice to clean it. And there, that's the eardrum. Ear canal is completely clear, and the ear is healthy. Now, this is the other side. It's not completely blocked. As you can see, there's a gap at the bottom, which means that sound is still travelling through, but there is a large blockage across the middle of the ear canal. And what we're doing there is just holding onto the wax and gently bringing it forward. It hadn't been compacted into the ear. And a solid piece on the side, fairly dry. Came out nicely. And again on the other side. That's dry skin and dead skin. And lifting up the wax from the bottom of the ear canal. See the long stretchy skin coming up behind it. So there is still a build-up of wax, although this does not affect your hearing in any way. But the clearer the ear canal, the longer the benefits of the wax removal will last. Some more on the side, on the other wall. Lifting up gently. And there, we have the eardrum. And the patient had used a cotton bud, and that's caused some bruising on the eardrum. But there's no perforations, the eardrum is intact, and there's the light shining back, reflecting back, which is great. Thanks for watching, and stay tuned for more videos.